Welcome to the National Chinchilla Society YouTube channel. Today we're going to present a short video that explains malocclusion in chinchillas. Before I remove the cloth, I want to warn viewers that underneath there is a skull of a chinchilla that has maloccluded, so if you prefer not to see it, please switch off now. Of course, this video is not a substitute for veterinary assistance, and anyone who has concerns about an animal should seek the appropriate professional advice. Here is the skull and also two separate jaw bones. So what is malocclusion? Malocclusion is actually a general term for any sort of misalignment of the teeth. In this video, we will be focusing on cases that involve root elongation. When we talk about root elongation, unlike humans, the chinchilla does not actually have distinctive roots to their teeth. The part of the teeth in the root area looks the same as the crown, or visible part of the teeth. If I remove the tooth, you can see what I mean. The teeth grow approximately 2 or 3 inches a year, hence why they need to gnaw on hard items and eat plenty of hay. The chewing action of eating hay helps to naturally grind down the teeth. Looking at the skull helps explain what happens when a chinchilla maloccludes with root elongation. If we first look at the visible part of the teeth, these become misaligned and overgrown. You can see in the skull of this animal that the top 2 front incisors are curling backwards and could potentially grow into the roof of the mouth. The back teeth are growing outwards into the cheek area. This obviously makes it extremely difficult for the animal to eat, as well as being very painful for it. As well as looking at the crown of the teeth, we also need to look at what is happening under the gums. You can see from the skull and jaw bones that the root area is growing downwards into the lower jawbone, hence the bumps, and upwards into the eye socket. In fact, it has broken through the bone in the eye socket area. These bumps you can see are actually the root area of the teeth. It is obviously an extremely painful condition for the animal. So what are the classic signs of root elongation? The animal will begin to eat less and start to lose weight. The eyes may start to become watery or get infected. They may pour at their mouth and they will eventually develop what is commonly known as the slobbers. The slobbers is when they dribble from the mouth and sometimes the nose, making the fur under the chin and down the chest wet. They also progressively become less active and can start to have an hunched appearance. It should be noted that chinchillas can develop the slobbers for reasons other than malocclusion. Examples are coughs, colds, infections. So if an animal appears fit, healthy and active one day and then develops the slobbers overnight, do not assume it is malocclusion and ensure your vet has a full history of the animal's health. Malocclusion is a progressive disease and usually it takes some months before the more obvious symptoms occur. As it progresses, the root of the teeth grow further into the eye socket, nasal cavities and into the jaw lines. Chinchillas are prey animals, so they're very good at hiding illness. It might be a few months before you realise there is a problem. It should be noted that the teeth of a healthy adult animal should be a deep orange colour. However, the teeth of a newborn is white and that of a lactating or pregnant female often turns to a pale cream colour. So what are the potential causes of malocclusion? One that is often talked about is genetics. There is no doubt that there can be a genetic link, but responsible breeders will try and breed this out. Malocclusion is now rare amongst exhibiting breeders in the UK. If there are cases in a certain line, this can often be backtracked through the pedigrees. Any responsible breeder, if they have a number of related animals that malocclude, then all related animals need to be pulled out of breeding, since it simply perpetuates the problem. Closely related chinchillas should never be bred together. For example, a father shouldn't be bred with a daughter, nor a brother or sister, even if they are half siblings. This is because it can significantly increase the chances of genetic issues, such as malocclusion. It is important that any animal that is being bred has a known background and is free from any known genetic issues. Personally, I believe the biggest cause of malocclusion, especially in pet chinchillas, is trauma or accidents. Chinchillas have no sense of self-preservation and can find danger in almost anything. A bang to the jaw that misaligns a tooth can easily lead to malocclusion months down the line. That is why the National Chinchilla Society does not recommend tall cages without separate floors. The cage setup should be so that they could never potentially fall more than an absolute maximum of about 60 centimetres or 2 feet. Having lots of shelves or hammocks does not make a cage safe. It just gives them more things to hit on the way down. Equally, what's in the cage needs to be safe. An example is the links on anything with chains. These need to be small enough so that the animal cannot get its front teeth caught in it, which could result in malocclusion. Any free time out of the cage needs to be closely supervised and be in a safe environment. This is to avoid falls, bumps, etc., and of course ingesting something that they should not. It is also thought that a chinchilla can start to malocclude due to underlying health issues and or old age. The teeth are a weak point, hence ongoing health issues can cause the connective tissues to weaken. Poor nutrition can also be a problem. Feeding sweet stuff can obviously cause decay. If their diet does not meet their nutritional needs, this can present problems further down the line, with the connective tissues holding the teeth in place weakening. Equally, they need the chewing action of eating hay to help naturally wear down the teeth. So how do you check for malocclusion in a live animal? If we go back to the image of the lower jawbone, if I run a finger or a thumb along the bottom and the side of the jaw, the bumps are very obvious. So with a live animal, you attempt to do the same, feeling for bumps under the skin. This is not intended as a replacement for proper veterinary advice. This I find easiest to do by holding the animal to my chest and then using my thumb to feel for bumps. For the purpose of this video, I will try and undertake the same procedure but with the animal on my lap and using my fingers. Right at the back of the jaw, where the lower jaw meets the upper jaw and where my finger is, you can expect to feel a bump. This is normal. If you then press quite firmly along the jaw lines, you should be looking for a smooth jaw. If there are lumps or bumps, then that could be a sign of malocclusion. Very occasionally, you will get an animal with a slight bump in the jaw, which doesn't develop into anything more serious. If you suspect the animal has a health issue, this requires a visit to the vet. So what is the prognosis if your chinchilla has a confirmed case of severe root elongation? A vet may be able to burr down the visible part of the teeth, but this does not resolve the issue of the root elongation. Any surgeries are likely to just simply prolong the life of the animal by a matter of months and no more than a year. The quality of life for the animal needs to be given serious consideration, and this needs to be factored into any decisions made.